it's good to know a little bit about Finley's Acute Inpatient Rehab Unit. So this is a really interesting unit. We're one floor inside the hospital that takes care of patients after they've been hospitalized. So essentially the medical staff is now saying you're too good to stay in the hospital, but you still need some help before you go home. Classically, what will happen is our therapists, physical, occupational therapists, speech therapists, will go meet the patient on the medical floor, as well as the physiatrist. I'm a physical medicine and rehab doctor, and then encourage and invite them to be part of our program. Here at Finley, I'm honored to be part of the team. We have awesome leaders, including Sarah Ryan and Jen Sweet. We are actually part of a bigger system, as you know, called Unity Point Health, where we have acute rehab units in multiple facilities. Finley was the first rehab unit to go out of their way to help serve their community, and has offered guidance to all the other rehab units that are now following suit in helping rehab COVID patients. Once you start to have difficulty breathing, it affects every other organ. It affects your brain because you're not getting good oxygenation. Our speech therapists can be involved in their cognition training, getting to see how their memory is doing and giving them skills. The physical therapists can get involved with their balance and strength, especially with the lower half of their body. If you've been laying in bed for a week or intubated for a week after suffering from the COVID illness, your legs are going to be pretty weak. Trying to get up and stand is now a new event in life. And this is where physical therapy really comes into play. And the occupational therapists do some of the most simplest yet powerful tasks. How am I going to get dressed? How am I going to bathe? How am I going to get ready for the day? Activities of daily living. They also work on a lot of upper extremity strength and range of motion. Most of the literature says every day you lay in bed in the hospital, you lose a certain percentage of muscle mass. And some of the data has shown within a week you can lose up to 40% of your strength. To go from getting off a ventilator and losing 40% of your strength and then trying to get home is quite the leap. Finley Rehab is that beautiful transition where they understand the problem, they have the team professionals to help, and it also helps build the patient's confidence to get home and do well. So essentially what we've done is try to maintain some sort of quarantine even inside of our rehab unit. So we call this isolation precautions. First, sanitary hygiene is extremely important, mopping, sweeping, and wiping, so we love all of our custodial services here. On top of that, staff every day get their temperatures checked twice, upon entering and upon leaving the unit. Then when working with a patient who's COVID positive, we have to wear obviously a face mask. We'd also be wearing shields, and we'd be wearing special gowns to keep us protected. We try our best to arrange therapy in a way where the COVID positive patient who's still infectious would get a great rehab experience while isolating them from some of the patients that are not, so we can protect those patients as well. The team goes out of their way to be extra precautious while at the same time making sure the patient feels comfortable where they are. What's fun about inpatient rehab is you get the same team every day for 2 weeks. You get very attached to them, and we get to watch them progress. And by the end of it, they've gained their confidence to actually get home, do well, and not have to come back to the hospital because of some accident or incident that happened at home.